We are live. All right. Hello, everybody. It's Dr. Earle. We're here at Pure Plastic Surgery. And it's Hump Day with Dr. Earle. So it's a time we get to spend with you guys and answer all your questions and things like that. But today, because a few people have been asking, to kind of give a tour again. It's been a long time since we've kind of given a tour of the OR, the recovery room, and then some people are asking about like sterilization and things like that. So I thought today we'd kind of like walk around and just go over a few things that we have here in the OR and recovery and everything else, and hopefully answer a few questions along the way. All right. So we're starting here in the operating room. So I brought a lot of the machines that we use in here so that we can kind of just take a quick kind of peek at all of them here. As I'm standing here, kind of the one that kind of stands out here behind me is one machine that's not actually mine. That one actually belongs to Raquel, which is our nurse anesthetist, who's awesome, and sometimes her husband, who also comes in and helps out. So this is a pretty much the same type of anesthesia machine you would have at any major hospital, any major OR. This is pretty much that level of anesthesia machine. It wouldn't be any different if you're doing, say, a heart transplant, for example. So that's the type of the machine we have here. It has pretty much all the bells and whistles, all the monitors you can think of. We got your blood pressure monitor. We got your O2 sat monitor. That's the one that goes in the finger. That's why we ask you guys to not have the like the dark colored nails or the acrylic nails, so that we can monitor the oxygenation with that one there. And then of course we have the EKG leads, which measure kind of the heartbeat. Okay. And then this gives you your gases for your sedation, gives you your oxygen as well. And then this back here is what kind of pumps, as the machine helps you breathe, because we do everything here under general anesthesia. Okay, so that means that we do put the tube in, and then the machine is what helps you kind of breathe throughout the case. Okay, so that's kind of the first thing that stands out here. She has her own little suction pump in the back there as well. And then as we kind of come around the corner, it's kind of a little nook area where we store a few other machines here as well. The first one I'm going to kind of pop out. This one here, this is the light that I use mostly for breast. Okay, so I don't like to use the headlight, the one here on the head. Some surgeons use that one. I use one that's actually part of the retractor, so it's called a lighted retractor, and this is the light source for that retractor. So that helps me make the pockets for the implant. So whenever you see me doing that pocket, what I typically do is that dual plane pocket for the implant. I use the lighter retractor here. Okay. All right. Back here we also store our body type. Now you've heard me talk about that quite a few times, so I'm not going to get into details here today. But we have our body type machine here. That does the body type for the arms, the abdomen, the back for the larger areas, but it also does the face type for the chin and neck area. As well as the Morpheus back here, which is kind of the radio frequency microneedling that we are able to use with the same machine as well. In the back of the nook are all our oxygen tanks and nitrous tanks back there. But the one thing I'm going to try to point out, and I'm not sure if you guys can see, it's not really much to see, but it's basically this big kind of box that we have back here. So this big box here is actually very important. It's not much to look at. But what that box is an energy source. Okay, it's like a huge battery. So if we were to have a blackout, we lose electricity while we're operating, then we just connect everything to that box, okay, and we're able to keep going. We're able to finish the case, get the patient safely to recovery. Of course, we wouldn't do any further cases at that point, but we have enough energy stored in here to be able to finish any case that we do. We don't really do any case that's longer than 3 hours. That has like a 6-hour battery life, so we're good to go.
Have you had to use that before?
Fortunately, no. We've actually, up until now, we've been okay. So we haven't really lost power in the middle of a case. So we've been pretty fortunate, but we always have that ready, charged, and ready to go in case we need it. All right. All right, so I'll have you guys kind of pan out this way as we come around. So the other thing we use here every day is our cell saver. All right, so again, we've talked about this before, but this is what it looks like once again. So we have our cell saver here, and this is what's going to basically, when you do liposuction, you have your fat, you have your fluid, and you have your blood. We separate the fat from the bloody fluid. The fat's what we use for transfer. We're doing a BBL, and then we run the bloody fluid through the cell saver. The cell saver has multiple filters and everything else, and it's able to separate the blood from the rest of the fluid, okay? And then we can give that blood back to you pretty much as an auto transfusion, all right? And so when we do that, there's less blood loss overall for the case, okay? So you feel better, you feel stronger, you're less lightheaded, less kind of passing out, things like that. And basically overall less blood loss for the case, okay? So we highly recommend the cell saver pretty much for any major liposuction case, whether it's Lipo 360 or Lipo 360 plus BBL.
We have a quick anesthesia question.
Yeah.
When patients are under, do you use breathing tubes, and are they sore when you pull it out?
Yeah, so that's part of what I was pointing out there. So yeah, so the machine there has what's basically what's very similar to a ventilator, okay? And so we do use the breathing tube that is placed in between your vocal cords, okay, to help you breathe throughout the surgery, since you're completely under general anesthesia. Can you have some soreness afterwards? It is possible. Raquel is very, very gentle. We do use small tubes as well to try to try to minimize that. But it is possible to have some, kind of some soreness in the throat after surgery. Typically goes away after a few days. If you feel like it's, just bothering you a bit, you can always use like a throat lozenge. You can get lozenges from any CVS or Walgreens, and that's going to help as well. Okay.
Do you know how much blood is salvaged using the cell saver?
Oh, well, that depends. So, how much you bleed, basically. So the more you bleed, the more we salvage. What's the average volume? Average volume is anywhere between 200 to 400 cc's that we give back from the cell saver. But it really depends on the patient how the case went. So, the more basically, if you bleed a lot, we run it all and we try to salvage as much of it as we can. There's really not an upper limit to that. Okay. All right, so just coming back around, this is the workhorse. This is our workhorse here. That's our lipo machine. Okay, so we use the micro air. This is a power assisted lipo. Okay, so what does that mean? It's not an energy based lipo machine. Okay, so it's not like the smart lipo, which is a laser based. Okay, or the one it's a little confusing, but it's called Vaser with a V. Okay, the Vaser with a V uses ultrasound energy. All right. And that's totally different than like I talked about, I think it was last week or maybe 2 weeks ago. That's totally different than the ultrasound that we use for imaging, that we use for the, for the fat transfer. It's two totally different things, okay? You can't think of it as the same, even though the word ultrasound is used for both, okay? But anyways, we don't use any of that type of energy. We use the micro air, which means power assisted, which is kind of mechanical, so it's that kind of vibration. It does help make the liposuction easier, especially for those that have like the tougher fat or the round tubes that have a little bit more scar tissue or fibrosis. It definitely makes things easier for that, and we're able to extract a little bit more fat as well when we use the micro air. All right, down here is part of what we call the sequential compression device. So that's what connects to the little booties that we then put around the legs during the general anesthesia, and they squeeze and let go, squeeze and let go, okay? And that's what helps keep the circulation moving and helps prevent, can anybody guess? It helps prevent the DVTs and the PEs, that's right, it prevents the blood clots, okay? So we have those on you at all times during the case, all right?
Do you require anything post-op to prevent DVT?
Yes, I require a lot of cooperation from our patients, okay? They have to walk. Walking is extremely important. So you got to do a few things. You got to wear your compression stockings, okay? You wear those for the first 7 days. And then walking while awake is extremely important. You got to walk at least 10 minutes every hour while awake, okay? And for those patients that are having either a longer trip, any flight that's longer than 3 hours, we do make basically a compression device that's mandatory. You guys have probably heard me talk about it. It's called the Circle 8. So the word circle, CIRCUL-8, okay, and that's basically a sequential compression device that's on battery. So it's wireless. It doesn't have it's not connected to anything, so it works great. It's battery operated. The battery lasts 8 hours, so it lasts for pretty much any long trip that you have to do, even if you're coming from Europe. And we do have patients, coming from the UK and other countries in Europe, and the Circle 8 works very, very well for that as well. Okay. All right, so I think we've got, no, we forgot the Bovie. All right, so the Bovie is the machine that we use for the surgical cases. So that's used for all your tummy tucks, your breast lift, breast reductions, augmentations, anything of that nature. Okay, so the other word for Bovie are the general word is the electrocautery. Okay, so that's what helps us do all the dissections, and it's very, very important for all those cases there. All right. Okay, so that's pretty much the OR in a nutshell. So as you can see, we have everything that you could need in terms of safety, and of course that I need in terms of doing the surgery as well. So let's walk over here. And this is our hand washing station. Okay, so of course everything's sterile. We got to wash our hands before we go in. We use our special sterile brushes up here. It's also our eye wash station in case somebody gets something in their eye. So it kind of works for both things. You got your eye wash station back here and our hand washing station there as well. Okay, and we're gonna make our way here into recovery. All right, we have 2 recovery beds here. Okay, again, fully monitored. Okay, same way that as any recovery bed would be at any major hospital. Okay, each one has their own screen. Okay, again, we're measuring all your vital signs, your blood pressure, your oxygenation, your heart rate. Everything's being measured there. Each one comes with its own oxygen tank in the back as well, because you do require some oxygen as you initially wake up from anesthesia until you're feeling more awake and everything else, and then we remove that for you, of course, certainly before you go home. One thing that always happens when you come out of anesthesia is you feel cold. You're cold and you're shivering, okay? Part of it is just the effect of anesthesia. Part of it is that your body temperature is lower. And so we have here what we call the bear hugger. So the bear hugger is down here. We use that. It can heat up 3 different, 32 degrees, 38 degrees, 43 degrees Celsius, whatever we need to warm up the body after surgery. So one of the first things after we get your monitors in place and we make sure you're doing okay, then we throw that bear hugger on. We increase your body temperature, make sure that you're feeling nice and warm and cozy out here in recovery. We also have suction back here for the recovery room nurse in case she needs that. Also very important back there. And then our new addition, I don't know if you guys can see it, the molecule here. There's an air purifier. So this is a Pico type air purifier. It's supposed to kill all sorts of bacteria and viruses. Okay, so we've added that recently due to COVID-19. So we have our basically our Pico air purifier here in recovery as well, trying to kill anything that's in the air in the nearby vicinity here in recovery. Okay? All right. You can't have an operating room without a crash cart. So we have our crash cart here, okay? So we have everything that we need. We have our hardboard here for CPR in case that's needed. And then we have all medications, everything that's important in terms of a real emergency is within this crash cart, okay? Including the defibrillator as well. Okay, defibrillator gets checked every single day. Make sure that's up to date and working well, and everything's good to go just in case we have an emergency.
What is the procedure to sterilize the OR after surgery?
Yeah, so that's a good segue. So we're gonna walk in here into our sterilization room. Okay. Then we hit the light. There we go. All right. So in order to sterilize equipment, you need a sterilizer. Okay. And we have two big ones here. So these are the 2 sterilizers that we have back here. So we got 2 sterilizers. And that's where all the equipment gets sterilized. Okay, it gets sterilized due to elevated temperature and pressure. Okay, so temperatures get up, super high. They get up to 250 degrees or so, sometimes even 270 degrees Fahrenheit for certain equipment. So super high temperatures and high pressures are what sterilize all the equipment. And these are pretty kind of standard sterilizers for the OR, but these are some of the bigger ones that they have. So that's why it's an Easy 11 Plus. We got to get the big size so that we can really make sure that we have some heavy duty machines working here. In the back here, there's also a special fluid, okay? It's called Sidex, but it basically is a fluid that kind of kills everything. So we use that as well. Some people would tell you that if you do this, you don't need that. If you do this, you don't need that. Why not just do it both? We do both. All right, we try to kill everything, whether it's through the fluid, through the temperature, through the pressure, okay? One thing that you see here in the sink that we use to clean our instruments is a very special filter, okay? This filter here, this Q-point filter, again, also filters out approximately, they say 99.9% of all bacteria that may be potentially found in water, okay? So this is also a filter that's used in major hospital settings. The filter gets changed every month, so it lasts about a month. Every month we change it. and pretty much, as the water comes out, it gets fully filtered here, so the water coming out to clean the instruments is devoid of 99.9% of any potential bacteria there. All right, so that's what we use to sterilize all the equipment, okay? And we'll just make our way back here. So how do we clean the OR? So we use the cavity wipes, okay, which those are the special wipes. Let's see, I have one here. I mean, this is pretty much used to clean everything, any surface, okay? So you have your cavity wipes, okay? Basically, they kill viruses, fungus, bacteria, pretty much anything you can think of. The cavity wipes are used to clean, so we use that to clean every single surface. So we do that at the beginning of the day, in between cases, and at the end of the day, okay? And then I don't think I'm gonna find it here right now, but there's also a special, similar to that, but in liquid form, that we use for the floors. And that's done again, beginning of the day, in between cases, and the end of the day as well. Okay?
We have an interesting comment.
Yeah.
Look how Dr. Earle holds his hands. You can tell he's used to being scrubbed in.
That's right.
Yeah.
Yeah, right. You gotta keep them out here. And between this here, you don't want them up here or down here as well. That's right. Okay, so I think we've kind of given a good overview here, but so this one I'll be happy to answer any questions, whether it's related to the OR or recovery or anything else.
So I know that you have brand new equipment. How do you know when something's getting outdated, or do you test the equipment regularly?
Oh yeah, that's a great question. So yeah, we do test the equipment regularly. It does have to be tested, actually, not just like by us, and the people, people here working and using it every day, but you do have to have like it's kind of like a biomechanical engineer, and so they come in and test it periodically. So they test all the machines, and then they have to put a little sticker on each machine saying that it's been tested and that it works well and everything else. And so we do that periodically, not only for us because we want to and want to make sure everything's working well, but we have to do that for our inspections as well.
How long does it take for your team to clean the operating room after a surgery?
So we were pretty efficient, and we have 2 people that help. So it typically takes a bit under 30 minutes, a little less than that, to really kind of clean everything. And then we have enough equipment for multiple cases, so we don't have to basically re-sterilize equipment in between cases, because we have enough packs that we can use that throughout the case, and then at the end of the day, everything is sterilized for the next day.
Do you have an assistant in the OR? If so, what types of tasks do they help you with?
Yeah, we have actually 2 assistants, and they're both surgeons, and they help with pretty much throughout the entire case. So they help set up the case, they help set up the instruments, they help with any kind of non-critical portions of the case. So they're basically both my additional right and left hands. And yeah, no surgeon is able to operate alone. We need people to help retract. We need people to help, so that we can see. We need people to help, set up equipment and all these things. So they're extremely helpful throughout the case.
So including everyone, how big is your OR team?
Well, so we have the anesthetist, Raquel, which you guys have, or some of you guys have met. Of course, there's myself, and then the 2 assistants. So that's 4 people that are basically in there. And then we have the 2 what we call circulators, okay? And then we have Jenny, which is our recovery room nurse. So all those people comprise the team.
How long are we in the recovery room before we're released? Is there a time limit?
Yeah, so there's no specific limit, okay? Now, the average time that people are here in recovery is about an hour, okay? So you're an hour in recovery. But if you need some more time, that's certainly okay. We'll give you the time that you need. On the flip side, you can't be there forever, right? So, if you're feeling well, you're doing well, your vital signs are great and everything else, then yeah, there is a point where you'll have to kind of leave the facility. Of course, as long as you're medically stable, and that's without saying. But because we do have only the 2 kind of recovery room, and we typically do about anywhere between 4 to 5 cases a day, we can't have someone here just kind of resting all day. Okay, so after everything is medically stable and you're doing well, then you'll have to leave the facility, as all the surgeries that we do here are outpatient surgeries, meaning those are surgeries that you do go home the same day.
Do you take breaks while performing surgery or in between?
In between, certainly, yeah, we take breaks in between cases. I do, you know, there are times when things are being set up, or when patients are either getting, getting into anesthesia or out of anesthesia. There are certain periods where I don't necessarily have to be in the room, and that's the opportunities that I take to see like my, my post-ops, my follow-ups, my pre-ops, and things of that nature. So I do, so in between cases, while things are being set up, things like that, I take those opportunities to then be able to do other things and then come back for the, once the case actually starts.
So you just said you do 4 to 5 surgeries a day. What's the earliest time that you start surgery, and when do you finish your day?
So we typically start at 5:30 a.m., okay? And then it really depends on the day and the number of cases and everything else. But we're usually done at a pretty reasonable hour. So certainly by about 5 p.m. or 5:30 p.m., we're certainly done. Most days we're done by that time.
How do you stay on top of new technology and instruments that you can use in the OR?
So we do that through various means. So one is through medical literature. So of course I receive, journals and things like that. 2 is through the medical society. So I'm part of the American Society of Plastic Surgery. I'm part of the Southeastern Society of Plastic and Reconstructive Surgeons. And of course I'm also part of the World Association of Gluteal Surgeons, or WAG. So through those societies, we're always kept abreast of the newest technologies that are out there. And then, you also have your kind of your reps of certain machines that we're already using. So whenever they come out with a new kind of technology, or within that, that same line of, whatever it is, say for example, the body type. Okay, so say they come out with a new body type machine in 2 years, then of course they're going to come to us and let us know, hey, we have this newly improved body type, blah, blah, blah. And so we'll look into it at that point. So there's several things that kind of keep us updated as to what are the newest technologies, what works, what doesn't work. And we try to kind of grab knowledge from all those things and apply it to Pure and to our patients as best we can.
What do you do for patients who have high blood pressure, or even a patient who their blood pressure rises during surgery?
Yeah, okay, so...
Or falls.
Right, exactly. So, okay, so simply having high blood pressure is not a contraindication to surgery, as long as you come in, with basically your pressure being controlled. So your PCP says that you're on the proper medication and your pressure is appropriate. If you come in and and we check your pressure out in pre-op and it's completely out of control, then we don't do surgery. We have to cancel. We have to say, hey, we got to come back another day. All right. Now, if everything looks fine and you're in the operating room and pressure starts to move up or down, we have all the medications that you can possibly need in order to control blood pressure. Either way, whether it goes up or it goes down, we can control it with the medications while you're under.
All right, so I know you have to go soon, so anything else you want to cover before you get out of here?
No, I think that's about it. So I think we've gone over a lot of things. I know it's been a while since we've taken kind of the tour of all this area here, so I hope you guys enjoyed that. I know that people were asking about the cleanliness and sterility and all the things that we do, so I was glad to be able to answer those questions. We are planning on having a few guest speakers over the next few weeks, so I kind of want to make these hump days, a little, having like different perspectives, so it's not just me all the time, right? So we're gonna have, I think we're gonna have some. Let's see, what did we talk about? We talked about dietitian, nutritionist. We're gonna have a few more talks on post-lipo massage. So some massage therapists are gonna be coming along. I think we're thinking about having Raquel come back for another kind of overview regarding anesthesia, because I know there's always a lot of questions for that. And so we're very excited. So we're gonna have a lot of people coming. So I want all you guys to stay tuned. And remember, Hump Day with Dr. Alex Earle. Take care. Ciao.